Now let's talk about at the start of the podcast, you brought up a case example with, I believe it was a female, generalized anxiety disorder, having insomnia, muscle tension, gastrointestinal issues. Can you give us a sense of what the medication plan was for this woman?
So we started Sertraline, brand name Zoloft, which is perhaps one of the most commonly prescribed antidepressants. So we started a small dose of the medication, maybe
give the audience the dosages. They want to
25, 50 milligrams, and we would up titrate the medication based on their symptoms. So it's important to note that antidepressants will take time. A lot of people with anxiety disorders, they feel uncomfortable. You want a solution now. While there are some medications that may confer benefit as quickly as 30 or 45 minutes after you take the medication, for example, antidepressants don't. They take time. They often take, we consider, 4 to 6 weeks, maybe even longer at a specific dose before you get the maximal benefit. So I always encourage people, you have to take the medication daily. You may not notice anything immediately, and we may require several dose adjustments until you get to a point where you're feeling better. And I know that can be a tough pill to swallow because a lot of people want to feel better.
Not
now.
literally.
Not literally, but metaphysically, I guess, right? So,
Doc, I'm not depressed. I'm anxious. Why would I start an antidepressant?
So it's important to note that antidepressants, while they're characteristically understood as being for depressive disorders, mood disorders, they confer benefit for a large number of other disorders, including anxiety disorders, including post-traumatic stress disorder, and some antidepressants may be used specifically for sleep alone. For sleep may have many etiologies, including anxiety, depression, but sometimes just classic insomnia. Antidepressants can be helpful for sleep.
Yes,
So
it's a misnomer.